A look at the United States Department of Health and Human Services, a SWOT analysis. What's to come? The United States has a number of federal agencies, each of which devote their efforts to providing the American public with various services that help protect, sustain, or improve lives. Of the several different federal agencies that exist, the Department of Health and Human Services plays a vital role in the health and well-being of American lives. What do you mean by the Health and Human Services Department? According to the healthandhumanservices.gov website, the Department of Health and Human Services has 11 operating divisions, including 8 agencies in the United States Public Health Service and 3 human services agencies. These divisions administer a wide variety of health and human services and conduct life-saving research for the nation, protecting and serving all Americans. The Office of the Secretary, HHS's Chief Policy Officer and General Manager, administers and oversees the organization, its programs, and its activities. The Deputy Secretary and a number of Assistant Secretaries and office support. How does HHS strengthen our country? A strength of Health and Human Services is the ability to enact federal policy that is critical at times of emergencies. As our country has withstood wars, depressions, recessions, and medical crises and emergencies, HHS is one of the departments that is most utilized. Its major responsibilities include administering temporary assistance to needy families, a state federal welfare program that succeeded the Aid to Families with Dependent Children program, and the Medicare and Medicaid health care programs that reach about 1 in every 4 Americans. According to the Washington Post, in 2013, during the Great Recession of 2008-2009, the food stamps program enrollment rose because the unemployment rate hit the stratosphere. The Supplemental Nutrition Assistance Program, SNAP, helped families hit by economic distress. The program has helped keep 4.7 million people out of poverty. One of the weaknesses of HHS, on the other hand, the very services and programs that provide individuals and families with a lifeline during times of crisis can also be a weakness for the American public who are the recipients of the benefits. With the phase down of federal support from the American Recovery and Reinvestment Act, ARA, the budgets for a number of programs have been cut in recent years. State investment in programs serving children is particularly important for children growing up in low-income families. The numbers have increased in almost every year during the past decade, but the rise was particularly sharp in 2009 after the start of the Great Recession in 2008. An opportunity of HHS. Equally important is the fact that the Department of Health and Human Services has offered an incredible opportunity of obtaining health insurance to so many that had previously been without. Keller and Chamberlain insist, effective 2014, all citizens would be required to have health insurance through public or private sectors or pay a penalty on their income tax. Subsidies would be available on a sliding scale for those with low income who are not eligible for Medicaid. These interventions were expected to reduce the number of uninsured people in the United States from 52 million to about 26 million. What a huge relief to so many Americans to finally have health coverage and have the ability to see a doctor when needed. A threat of HHS. The threat of hackers exploiting weaknesses in government computer systems and networks has prompted the use of cloud servers, which provide added security. McKenna adds, the cloud offers increased efficiencies and cost savings, and the U.S. federal government has taken notice. A massive migration to commercial cloud services is underway, and it's no mean feat. It necessitates the creation and implementation of a migration strategy that moves selected new and legacy functions to cloud technology without disruption and with maximum security. SWOT analysis of HHS in a nutshell. The Health and Human Services Department offers an array of services and programs to our nation's citizens and residents, some of which are vital to the well-being of some individuals. Although the programs are extensive, as is with any agency, there are strengths, weaknesses, opportunities, and threats that must be assessed and discussed. HHS offers help to many in times of crisis and when policy changes and allocations are decreased. those same individuals can sometimes find themselves in the same predicament as before. The implementation of Obamacare has assisted millions of uninsured individuals. However, the program is very controversial and the country stands divided on the topic. In our world of technology, cybersecurity is at the forefront, and the use of secure cloud servers appears to be the solution to maintaining government data out of the hands of hackers. Without the vital services and benefits that HHS provides, millions of American families and individuals could find themselves without somewhere to live, food, and the ability to see a doctor when needed. The Department of Health and Human Services is vital to the nation. References: Buck and Cassidy, Keller and Chamberlain, McKenna, HHS.gov, and the Washington Post.